Hi, my name is Sandy Midcoast. I'm a family nurse practitioner and a breast cancer survivor.
Hi, my name is Connie Tyndall. I'm an office manager for Dr. Tyndall, and I'm a breast cancer survivor.
My name is Millie Smith. I am a certified coder in medical records here at Washington County Memorial Hospital, and I also am a breast cancer survivor.
I just want to talk about the importance of getting your mammogram. It starts at age 40, and it's recommended yearly, and also to get a clinical breast exam with your healthcare provider every year. I even encourage my patients to start as teenagers self-breast exams because they can know what's normal for them and what is abnormal, because can affect younger people also. I'm a very big advocate on screening testing. Early detection is anybody's best friend. It's best cure. There's people out there that love everybody and would think it's important to get these screening tests. They diagnosed mine very early, so I did not have chemo or radiation. It was an option to me, and I just chose a bilateral mastectomy. And I had no further treatment, and everything's good. They got it all.
Well, I want to kind of feed off of the fact that you said young teenagers to go ahead and do the self-exam and see their physicians, because when I was 17, I had a small lump, and they went in and they removed it. And then when I was 19, I had another small lump, and they went in, they removed it. They were all benign. And so from the time of, knowing about it at such an early age, it was something that I did keep track of. I did have my mammograms. I did, what I was supposed to do. And from 19 until, I was about 52, I guess. And mind you, I had my mammograms every year. And it was August, and I'm also a foster parent, and I picked up one of my foster babies, and when I did, I thought, well, that felt kind of weird. And I waited a couple weeks thinking, it's not what I think it is, So in September, 1 month shy of my mammogram, I went to see my physician, and we had a mammogram and a breast biopsy, and I was diagnosed with breast cancer. And it wasn't because I didn't have my mammograms and wasn't checking. I did. And in those 10, 11 months from my mammogram the year before, I developed cancer. And so it happens very fast. So if you don't keep up on it, and if you don't know your body, and if you don't know what to look for, it can be very hazardous for your health.
And I had a lot of lumps that were benign. They told me to give up caffeine, soda, and coffee, and I refused to do that. They said that causes these lumps in your breast. And to me, the lumps didn't mean a whole lot because I'd had them my entire life. But then I had a mammogram, and when Dr. Smith walked in and said, "Hello, Mrs. Tyndall," I knew. I said, "Dr. Smith, you did not come in to visit. Just tell me what the truth is, because I really want to know." And my left breast is gone. They took the whole thing off. I'm cancer-free after 8 years, but it is so important. And you get to know those lumps, as you were saying. If you do it all the time, you get to know those lumps that are not dangerous. But you really need that mammogram every year to catch anything that's different, because what they do is compare the old one to the new one, and then the next one. And so that way they can see the differences in those lumps that you have.
Yes. And I think another important thing to remember is there was a time in there that I didn't have my yearly mammograms. It was like, everything's been fine, I'll just leave it. And then my mom, of course, your mothers are always looking out for you, and she goes, "You need to make sure you start having your mammograms." I'm like, "All right, Mom, I guess I'll do it." I hate doing it. They hurt, they don't feel good. Well, after going through chemo and radiation, those mammograms are nothing. Those mammograms are, "You're welcome, let's do it, let's get it over with, let's make sure everything's okay," versus if you have to go through chemotherapy or you have to go through radiation, that's a whole different story.
Yes, that's prolonged. At least with my surgery, yes, surgery is not fun, and you have drain tubes, and you can't lift your arm, and Yes, but is
Compared to
it
what could happen,
compared
right.
to, compared to a simple mammogram?
Yes,
I would much rather have the mammogram.
Because you and I were caught very early and we were
Yes.
lucky.
Yes.
yes.
Very.
Because mine changed in a year. So-
Yes, so did mine.
And Millie said she
Yes.
did
So-
too, so.
It's, you have to do it every year, and I was like Millie, I cheated a few years, but
I don't now.
I don't now, no, because I know how important it is.
At Washington County Memorial Hospital, we have a really good setup on the mammography. It is still a little uncomfortable, but it's not as bad as like the old times that people freak out about. And like I said, the staff is very good about, your comfort level, and they will talk you through it, and it's really not a bad experience at all. So with my patients, most insurances will pay for a yearly wellness exam. And if you're over 40 in the right age group, they'll pay for a mammogram, and sometimes they'll even pay for like a bone density test. It's very simple. I just simply put in the order. If we have to check with the insurance, the office staff does that to make sure it gets paid for. You just come in here. The staff here is phenomenal. That's what they do. It may be a little uncomfortable, but they talk you through it. It only takes around 15 to 20 minutes. And then, like I said, that 15 or 20 minutes could make a change in your life.
And I know the day I came in for my mammogram, because I knew something was wrong. They did the mammogram, and then they did an ultrasound, and I'm like, okay. And then she said, I'm gonna get the radiologist to look at it, and I said, okay. And so
You kind
then,
of know, don't you?
yeah,
It's
yes,
like
you
with
do,
Dr.
you know.
Smith.
So he
You
came in
know.
and talked to me, and he goes, we really think we need to do a biopsy. And I'm like, okay. He goes, when would you like to schedule that? And I said, I'm here right now. He goes, let's see if we can arrange that for you. And they went out and they called the insurance and took care of it. And I'm not saying they could probably maybe do that every time, but they will do what they can to get you to where you need to be. So, I didn't have to wait a week for a biopsy. I didn't have to, wait for that pathology report. It was a lot faster, and they just kind of took care of everything for me right there. He goes, you want to do it now? And I said, let's do it. And he said, okay.